We're live.
Okay, you all probably thought that we were done for the day, unless you're actually tuned into social media and you knew we were doing 2 lives today. But right now, we are here for our second leg of our healthcare journey in West Oakland at the West Oakland Health Clinic. So we're going to get a tour and talk more about the medical services that are right here in the community. So let's go in.
Yeah, you guys are here. Yeah, no.
Here we go. All right, we're here for our tour. So this is the beginning of our entry. So we're going to have everyone introduce themselves, the importance and the history of the West Oakland Health Clinic.
Hey. So, Robert Phillips, I'm the president and CEO of West Oakland. Founded, of course, a lot of community activism. So, quote unquote. So, they along with volunteer this clinic. Or on 12.
Wow.
Yeah.
Everyone else introduce themselves.
Hi, my name is.
All
right, I will start. Yeah, I will start. So, due to the UL entrance, which we will actually be reopening soon, and I believe we'll end there. Take a look. So yes, we came in through our back door. We're going to take you right down to our dental unit. So we have dental services, adult and pediatrics, 5 days a week, and then oral surgery provided on Saturdays. We're walking by our peds unit, our pediatric unit. This is where we see the moms and babies. And our key master will let us into the dental suite.
So once again, this is a full service health clinic?
Full service health clinic, yes.
With your own dental office.
Mm-hmm.
So when you say dental office,
and dental spa.
dental spa.
Dental spa.
Dental spa.
Yeah, our chief dental officer would be mad at me if I didn't specify
I stand
that.
corrected.
Yes.
So what is a dental spa?
Well,
This is not you just hand out toothbrushes. And,
Oh, no.
No.
Yeah. I hope the lights.
Here and after hours.
So you can see one of the oratories. So here, and then we also have little ones for peds.
You have little.
So we do adult and pediatric.
Yes.
You see how high tech this is?
I mean, shiny new. Yes, this is the spa.
That's right. And full service. So everything from cleaning to oral surgery.
Wow.
Yeah.
So adult and pediatrics.
Mhm.
I want to make sure that the people who are viewing this know that adults and children can come to this space for all of their dental needs.
Absolutely.
So that would be referrals out if you need orthodontic care.
Yes.
Correct.
Okay.
That's right.
Yes.
That's right.
Yeah.
So, and it's right in my dental.
Exactly. Yes. Right. I think next we can head to our pharmacy.
There's a pharmacy.
Mm-hmm. Actually, no, we'll stop by optometry on the way.
Amazing. Okay.
This is serious.
I mean, talk about one-stop shop.
Amazing.
Our optometry department is down the hall.
Ready to go?
Oh my goodness. There's glasses here.
Yeah.
Oh,
So
there's frames.
we
I
got
need my eyes checked. Because, okay. How do I get signed up?
Yes.
Well, we provide optometry services here.
I see all the ones that I need. I see all of the glasses that I
We
need.
have frames, and we have a partnership with UC Berkeley. And we have residents from UC Berkeley practicing here at West
Oh,
Oakland.
wow. So the residents actually come to West Oakland to train
Yep.
to be physicians and eye
Yep.
doctors. Wonderful.
Yeah, I recently had a doctor's appointment over, by Summit, and my eye doctor practiced here. He saw my West Oakland Health lanyard and was like, "Oh, I interned there."
Wow. So what does one have to do if they want to be a patient of the West Oakland Health Center? What does one have to do?
So we take all comers. They can call us, email us, even walk in. So it doesn't matter what their status is, their income status, insurance status.
Wow.
And if they want to be a member, all they have to do is walk through the door.
I could come here, and if I wanted to be a full-time patient here, I could.
Absolutely.
I would just have my insurance.
Yep.
Process.
We'd work that out for you.
Oh my goodness. Okay, I'll be back. Let's see how many offices there are here. This is amazing. This is amazing. 3 examiners. Awesome.
We also have top-of-the-line state-of-the-art equipment.
So how long does it take to get from an eye exam to having my frames?
Oh, that's a good question.
That's an excellent question.
Because I'm gonna tell you how long it takes you.
Right.
They're
We'll
never.
have that time.
I'm sure. I'm sure you would. Okay, outstanding. Where are we going next? What are we?
Pharmacy.
The
Yes.
pharmacy. That is
Right.
something I don't see often in health plans.
So we like most plans. Have a pharmacy. So we have full. Sorry.
No, no problem.
Like most clinics, we have full split service pharmacy. But we also have a retail. Makes us a little unique. Yeah. Um, just like you would any other retail pharmacy, CVS, Walgreens, same services. Oh, one question. As you know, so we're increasing ourselves, taking on more pressure over on Pill Hill. It's close downtown. It's close now. You know, outside of Chappell. It's not pharmacy for where you get both services, but also
All right, let me just set up our settings again. And we are almost ready to go.
On Facebook, Twitter, and Instagram,
All right.
and YouTube.
Okay, we're live again.
Okay.
So it is so critical that this center has a full service pharmacy. And some of the services that are offered here are emergency contraception, immunization services, medication consultation, over-the-counter medications, prescription counseling, and travel health clinic services. So that means if you're traveling, if you're going out of the country and you need immunizations, like went to Jamaica, I had to get some things. My daughter's going to Brazil. We're gonna send her here. My folks going to Kemet. For folks who don't know what that means, it's Egypt. There are things that you need to get. You can come right here to the clinic and get those immunizations. But what are the hours that we can come and get those things?
Yeah,
For the
8:45 to 5:15, 5 days a week. And those hours are slated to expand, but this is where we're at right now.
And they do close for lunch.
They do close.
From 12 to 1.
People need
Yes,
to eat.
exactly.
We need
Yes.
to respect our workers.
Yeah.
That's exactly
Yes.
right. That's
Did
exactly
we
right.
need to talk about the importance of local pharmacies because of the closures of some of the larger chains? Do
We absolutely
Mhm.
So can you just restate again why it's important to have local health-based services through the form of pharmacies in communities?
Yeah, absolutely. You know, as the chains close, and it creates, you know, a desert, just like they're food deserts, they're not pharmacy deserts. So access to, you know, prescription medication, as we know, is something that you actually need in proximity, and you need to get promptly. So the further you have to travel, the longer it takes for you to get that, the harder it is for folks to actually, you know, be well.
Yeah.
The second is, at least for us, you need a place that has affordable drugs too. So it's not just the access to the drugs, it's can you actually get them? And I'm not talking about walking through the door. You don't want to be paying $500 per prescription. So we get subsidies and we're in programs that allow us to charge at cost. So no one has to get gouged on the price of the prescriptions. And then third, it really is just about having access in your neighborhood to the range of care. So when you have your visit and the doc gives you your script to just walk around the hall, walk across the hall to get it, and that convenience makes it more likely that you'll be able to be adherent to whatever it is that's been prescribed to you. The longer distance you got to travel, the more inconvenient that is, the harder it is to actually do the things that make us healthy.
Mhm.
Outstanding.
Mhm.
And so where are we headed next?
To the front, to the
Yes.
beginning.
Very nice. I'm going to follow our tour guide.
And our adult medicine units are across from the pharmacy here. Now we're passing through waiting areas. We usually have some home education materials available. And so as I said at the beginning, you all came in through our hallway, additional services that we offer.
So you offer women, infants, and children services here as well?
Correct. Yep.
Absolutely.
Yeah.
So this is where families can come and get access to that very important early childhood health food
Yes.
service
Yes.
through the WIC program.
Yeah.
That is
As well
100%
as, you know,
correct.
parenting classes, you know,
Wow.
lactation courses.
Including for fathers. We don't forget about
There
our
you go.
fathers.
Moms and dads.
Yeah.
So lactation
Mhm.
courses.
Basic
Nutrition.
parenting courses, nutrition courses,
Wow.
you know, even like how to change diapers.
Oh.
Properly put someone in.
Right.
Yes.
Listen,
Yeah.
listen.
Yeah.
Car seats?
Mhm.
I almost had to have some mental health care based on the car seats of my children when I was bringing them home from the hospital.
Oh,
It can be so challenging if you've never done it before. So I'm glad that you offer that.
Absolutely.
Save some people's like
Right?
brain grapes. Yeah, outstanding.
Used to be, you know, our doors are still locked, but they will be open next month. And so this is where patients enter, get registered.
Oh, wow. And when will you reopen this entrance?
The top of next month,
Okay.
the day after the holiday.
Got it.
The July 4th holiday.
Yeah.
Yeah.
So we also do insurance enrollment here. We have certified insurance consultants here.
Wow.
Mm-hmm.
As well as enrollment in CalFresh.
Right.
Mm-hmm.
So in addition to what we do CalFresh, and we do what we call here CalWorks, but temporary assistance when you can.
So this is a basic one-stop shop
Yes.
where all of your healthcare needs can be met. And I just want to say, if people haven't heard me say it before, healthcare is public safety. When you have access to everything that you need, it just makes the community safer. And so to have access to food services through WIC, to have access to a pharmacy to get medications, to just be able to walk in is so critical. Like, if you don't have healthcare, I think you said earlier when we first started the tour, you can just walk in and just let folks know that you're in need. That is so important, to be able to meet the needs of the whole person, from physical care to also mental health services. I think it's really, really important. And it's a staple for our community. And have it right in West Oakland. I mean, come on. And the origin, to start with some Black mamas. We have to make sure that we are continuing to invest in these services and invest in this clinic. So if you are looking for a service provider and you live in West Oakland, or if you don't live in West Oakland, if you were pushed out, or if you are just in a different part of the city, this is an important resource. Take advantage of it. So if people do want to take advantage of your services, how do they find out? How do they get involved? How do they sign up?
Yeah. So they can go to the website
Mhm.
if they have access to that.
WestOaklandHealth.org.
They can call us 510-835-9510. Or they can just walk in.
I know, I was like, I think it's 9610. Wait, what's the number? So
510-835-9610.
That's it.
Yeah.
Wonderful.
Yeah.
And we also have other sites. We have a clinic at East Oakland, and we have one on 106 Town End Road, Oakland Port as well. So
Yeah.
covering Oakland, west to east.
And one thing you didn't see is we do have a team of community health advocates too, who assist patients that may have other needs, beyond clinical, beyond what we offer, helping arrange transportation for appointments, finding food resources, whatever other resources they may need, more addressing social determinants of health that can get in the way of people taking care of themselves. We also have a team of folks who help with that.
Right.
Wow.
Which is another way to get at us if you don't want to walk through the doors. We'll
Wonderful.
be out at these health fairs. So look for us.
Beautiful. Beautiful. Did I tell you all that you are heroes?
Oh.
Did I tell you that? If I didn't tell you, you are. And thank you for providing this resource and being a part of a long legacy of people providing this resource to our communities. It's invaluable.
Absolutely.
It's invaluable. So
Thank you. Thank you
so
all
much.
for
Yes.
coming down here and featuring us.
And for being such a champion.
Yes.
I mean,
Yeah.
I'm trying. Listen, if I would open up the world, I'm working on it. I'm working on it. This is just the beginning.
All right.
All right.
Everyone? No, I think we're good. Feel free to wave to everyone. Gonna end that.